There's no question strokes are a major health care concern for millions of Americans. Connecting Point correspondent Carolee McGrath spoke with Angela Smith, manager of stroke service at Holyoke Medical Center, to learn about the warning signs and the latest treatment available for stroke patients.
So the stroke can be equated to a brain attack. It basically is a blood vessel in the body either becomes blocked or it can burst. And the blockage type of stroke happens about 85% of the time. So typically it'll be more of a blockage type of stroke. And what happens is the circulation, sometimes I call it like the plumbing, a pipe, it just blocks. And then everything beyond that blockage, that blood clot, has no circulation, tissue dies, and then that's what is exactly called a stroke. So it depends on where that stroke is, on how severe the stroke symptoms may appear.
And so what are people left with? Because there's different kinds of strokes, are there not?
Yes. So we actually call the ischemic stroke, that's the blockage, or a hemorrhagic stroke, that could be aneurysms and different things like that. And now we even call the TIA, which are the transient ischemic attacks. If those even go on for a certain amount of time, that can cause a small little mini stroke in the brain as well, or it can just be devastating depending on where in the body that stroke happens. So the stroke, it's sort of like a map, and I equate it to, if it's in the front part of the brain, you may have some trouble with thinking and comprehending. Deeper in the brain, moving your arm or leg, your speech. In the back of the brain, back here, it can affect your vision and your balance. So it really depends on where the stroke is as far as what the symptoms are going to be.
So aside from the TIAs, small strokes can be undetected.
Very often they are undetected. When I have patients come into the hospital and we'll do a CAT scan and they'll come in with stroke-like symptoms, we'll often say, gee, did you know you have an old stroke? And they're extremely surprised about that, and that does increase their risk for another stroke. So there's something going on in the body that they need to control, and that's important for a stroke especially.
And so what are some of the risk factors, especially for somebody who had a stroke or who had no idea? Right. What did they miss? What symptoms did they have?
Primarily, the biggest risk factor is hypertension, and you don't really have a lot of symptoms from hypertension, so people discount taking their medicines faithfully. Diabetes, high cholesterol, smoking, those are all the main reasons for a stroke, and people don't seem to understand that if you control those type of things rough up the surface of the blood vessel. And when it's rough and blood is flowing through, it can get kind of caught up and then build up a clot upon a clot, and then all of a sudden you end up having a blockage in the blood vessel, and that's a medical emergency. We call 911, and now if you come to the emergency room, we can give you a medication that just dissolves the clot and restores the circulation, and people walk out of the emergency room, out of the hospital after coming into the emergency room rapidly and with really almost no deficits from a stroke.
Now, some of the symptoms, though, could be mistaken for something else, right?
Yeah.
If you had chest pain, or it could be something related to diabetes.
Right. So sometimes people have symptoms that come on and there's weakness on one side of the body, or they're stuttering with their words, or they're becoming extremely forgetful. And so some of those are vague things that people have every day. So it's really hard to identify, but the problem with a stroke is it comes on all of a sudden. The blood vessel will be open and then it's blocked. And if it's a small blood vessel, those are the ones that are silent strokes. People don't even realize they had. But if it's in a larger blood vessel, you'll have an impact where the nerve and the blood vessel run together, and you will have, weakness on one side of the body, and you will have problems with your speech. It's much more obvious.
Okay.
Yes.
And what about recovery for a stroke? Like you said, some people, walk out of the hospital with very little impacts.
Right. It really depends on how fast they seek help. If you get to the hospital right away, your disability can be minimized. Sometimes it's hard to know, but in other cases, you may need some rehabilitation afterwards, speech therapy, physical therapy, occupational therapy. But it just depends. I mean, half of my patients last year in the hospital went home from the hospital, went home because they actually came in early enough and the stroke might have been minor.
In terms
It
of
really
moving the
has.
needle?
It has.
Can you
When
describe
I
that?
started 12 years ago in this position, stroke was the third leading cause of death. Now it's number 5. It's still number 1 in disability, but the advances in stroke care, it's similar to heart care. We are able to open up blood vessels through medication, through devices if need be, and it's exciting.
Thank you so much for joining us. Very important information for people to look out for.
It sure is. Thank you.
Thank you.